Thank you very much, Larry, and I'd like to thank TAMEST for inviting me. They're actually in the same building as we are, but 3 floors down. I'm also very honored and humbled to be on this committee. I know, on this panel. I know most of the work of the investigators here, and I really admire it. I'd like to do my part for weight maintenance in this group here today, so if you could all stand up and just take a real quick stretch break. We've been sitting entirely too long, and I know how that affects kids cognitively. It does the same thing with adults. So if you just take a quick stretch, sit down when you need to. I was a drum majorette in high school. I have 4 kids. I'm used to talking above movement. So today, before I begin, I'd like to just talk a little bit about our center. Our vision is healthy children in a healthy world. So we know that we can't talk about child obesity without talking about healthy parents and healthy communities. I'd also like to acknowledge our funders, in particular the Michael and Susan Dell Foundation, and then finally all the investigators. I'm presenting the data, but there are whole teams behind me today. So you saw the data on obesity in the US. I'm going to drive this a little bit closer to home in Texas. And we have some new data from our school physical activity and nutrition survey. So this is objectively measured height and weight, similar to the NHANES data. And we took this on 4th grade, 8th grade, and 11th grade to represent elementary, middle, and high school. And I have data from 3 sets of years, 2000, 2002, 2004, 2005, and then 2009, 2011. So if you look at 4th grade, what you see is that we've seen a slight decrease that's kind of stayed steady over time. So this is similar to the US data. If you look at the yellow mark that goes along there, that's the Healthy People 2020 goal of 14.6%. So you see we still have a long way to go. If you look at the US data in comparison for kids this age, the prevalence of obesity is about 19.6%. So we're above the US average. If you look at 8th grade, over time, what we've seen is an increase. First, it was about the same, and then it's increased this last go-round. The US data that's comparable is about 18.1%, so we're well above that. And if you look at 11th grade, this was a surprising finding for us, is that it's really increased over time. And I'll address this again later. So one of the things that was mentioned previously was mixed messages, and I'd like to show you an example. This was in Austin, and the Wendy's says, "Beat diabetes, buy 5 Junior Frosties for $1." So if that's not a mixed message, the other thing I want to say is this is difficult to change. If you come back 2005, it says stop juvenile diabetes, Frosty coupons for $1. So even though this has changed, we still see that it's happened, the environment around us is not necessarily changing in response. So where do students learn about foods and nutrition? And when I talk about nutrition, I mean it in a more broad way. How do you choose foods to eat? How do you purchase foods in the grocery store? How do you prepare and store foods? So if you look at this, the recommended amount, and if you could focus on the red orangish bar in the middle, the recommended amount of nutrition education that we would like to achieve is 82 minutes per week. If you look at what we think is necessary to change behavior, and this is behaviorally based nutrition, so it's not necessarily just knowledge, but teaching skills and how to get people to change. It's about 42 minutes. If you look at the data, what's really provided is 6.7 minutes in our school. So when children aren't learning about foods and nutrition in school, where are they learning it from? Well, let's look at the other part. If you look at food ads, children are exposed to over 7,600 food ads per year, and only about 153 of those are talking about foods and nutrition. So that gives them 146 minutes per week of exposure to food ads. And if you look at the food and nutrition type ads, that gives them about 3 minutes of ads. So as you can see, if we're not teaching them, there's a vacuum and something fills that. And we think that this fills a lot of it. I'm not necessarily saying that the ads need to go away, but wouldn't it be great if what the nutrition information that we're giving them is at least a quarter, a third, or a half of what the exposure to the ads is. So one of the things I'd like to tell you about now is a project that I've been involved with for many years now, CATCH, the Coordinated Approach to Child Health. And what this is a school-based program that is kind of common sense in a way, but you go into the classroom, the children learn healthy behaviors, they're able to try that out. Because health is a science topic after all, and how you get kids to learn health, just like you do experiments in a chemistry lab, is you have them practice. And so you do it in the classroom, you go into the cafeteria offers the foods that you've talked about in the classroom. They go into physical education, they're kept active, they're not sitting on the sides, and then you send healthy messages home to the family, and the school has healthy messages. CATCH has an established evidence base. We've been working on CATCH now for over 25 years, and I will have to say I was 10 when it started. We also have more than 107 peer-reviewed publications. And what we have shown over the years is that we've been able to reduce fat and saturated fat intake in children's diets. We've been able to increase their moderate to vigorous physical activity. We've been able to actually change the school environment, too, to make it healthier. And these effects persisted over 3 years without additional intervention in these kids. We also had a replication study done by independent investigators in El Paso at UTEP, and they found a reduced prevalence of overweight and obesity in an El Paso trial of CATCH. Not only that, but we've seen significant translation when it's gone regionally wide. So like CDC, we have our Texas maps. And so this is a Texas map of data from 2000 to 2002. This is just for fourth graders. And what you need to know is this is by region of Texas, and this is from our SPAN data. And if you look at that, what you see is the orange is a 20% prevalence of obesity or greater. The red is a 25 to 29% prevalence of obesity. And then the yellow is a 30% prevalence of obesity. Now, this is in kids. This is not in adults. And it's pretty alarming because you look, and especially along the border region, you see high prevalence of obesity. When we came back and did this again in 2004, 2005, we found a surprise here, is in the El Paso area, we saw a decrease, a 7% decrease in the prevalence of obesity. And this was statistically significant. This is one of the first times that we've seen a regional prevalence drop in the prevalence of obesity among any population, and this was among kids, especially ethnically minority, low socioeconomic group of children. The other thing is people forget how big Texas is. The drop in this area is similar to if you had a drop in the prevalence of childhood obesity in South Dakota and Wyoming combined. So it really is a large effect. So what caused this decrease? One of the things, Paso del Norte Health Foundation funded a regional-wide level initiative in CATCH. So they put CATCH in the schools over an 8-year time period. They provided resources and support for them to implement CATCH. In addition to that, they did a adult program, Que Sabrosa Vida, which was a nutrition education program aimed at mothers and caretakers that was done at the schools. And then they did a program called Walk El Paso to encourage physical activity. In addition to that, several pieces of legislation were passed, included Senate Bill 19 that calls for coordinated school health in schools and physical education classes. We also had other policies, Susan Combs, the Texas Public School Nutrition Policy, which regulated foods in schools. And then finally, there were media messages. So I don't know if anyone here is from El Paso. Is anyone here? There were radio and TV ads that were reinforcing the messages that happened at home. One of the things that I forgot to say earlier is CATCH is really one of those programs that has not only individual it's not only targeting the individual, but also the environment as well. And what happened is in this implementation, it was placed into an environment where a lot of the messages were reinforced to both parents and kids. This is similar to results we've seen with other programs, most notably those in Australia and New Zealand, and then in Somerville, Massachusetts, that if you get a community-wide effort targeted at reducing child obesity, you can see population-level effects. We were able to replicate this in an Austin-Travis County trial, so we actually did the same thing in El Paso in a dissemination mode, and what we found was an 8% prevalence decrease in childhood obesity among fourth graders. We've also done some cost analysis of CATCH, and what we found is the cost effectiveness ratio of implementing CATCH is about $900 per child. Compare this to flu vaccines, the cost effectiveness ratio there is $140 per person, but an artificial heart is something like $9.3 million per person. So it really is, the cost effectiveness indicates that programs like this should be implemented. One of the things with going into schools is, why do you want to do it in the schools? The schools are there for academic pursuits, correct? Well, some data from a study that we have that is actually under review is what we did was we went into the schools and we did 60 minutes of physical activity a day. And so it was through recess, it was through PE, and some of the activities, just like I did with you here, where we made the kids stand up and we had activity breaks in class. And then what we did was we measured Stanford math scores. And what we found is in the kids who had the program, their Stanford math scores were significantly increased. And this effect actually was more prominent in females than in males. And then it was also more prominent in at-risk children. And at-risk kids are those that had problems with adaptability, social skills. So we had a measure by which we looked at that. And those were the kids that benefited most from moving around. One other thing that we found recently is in Travis County, the first few years we had a very rigorous implementation, and then the years out we kind of weaned ourselves away from the schools. And what we were looking at was how did they implement. And so if you look at those that were not implementers, that were not implementing much at all, what we see is there's a trend toward increasing prevalence of obesity and overweight. Those that were implementing somewhat, it kind of stays constant. And so this is what we've been seeing with the fourth grade data in Texas. So if you think back to the first slide I showed you. And then finally, if you look at the schools that were high implementers, what we also saw was a trend toward decreasing prevalence in obesity and overweight. So you have to do the program. It's user failure, it's not necessarily program failure. The other thing I want to point out is the low implementation. That's what we're doing in high schools right now. The legislation the past few years in Texas has decreased PE by 1 semester, and we've also taken out the health education requirement for high school students altogether. So I don't anticipate obesity and overweight status in the high school students going down over time in Texas. So just a few future directions that we're working on now. One of the things I hope that you've seen from this, and again, there's many other studies than what I can present here, are you need both individual and environmental changes. You can't really ask an individual to make changes without having a supportive environment. We were recently funded a grant by CDC. It's the Texas Childhood Obesity Research Demonstration Grant, and one of my colleagues, Stephen Pont, is here in the audience today. But what this is partnering with a wide variety of organizations and institutions in the community and academic and healthcare settings, and looking at the Medicaid population to see if we can affect childhood obesity in kids who are 2 to 12-year-olds. And we're taking a systems level approach where we have schools in the preschool, programs in the preschool, programs in the elementary school, programs through the primary care physician's office, and then programs in the community. So we're very excited. This has just started. It's a 4-year trial. And then finally, we're focusing on disseminating catch. We've now developed a middle school program. We're evaluating that now. We should have results soon on that, and we've got some funding to disseminate catch in Texas. So thank you very much for inviting me here today, and I think time for questions if anyone has any. Thank you.
I'll be an audience plant here for a second.
Oh, hi.
Hey, Deanna. So just to try to link a little bit the comments that Dennis Beer made and your comments, I know that you're working intensively on moving the catch program into the preschool environment, but I wonder if you could say anything about thoughts around moving it into even younger children. Are there ways to implement this kind of program or something like it in quite young children?
I think what we're looking at there is really, a lot of that is parent education. So how do you get to the parents? How do you teach them what to do? And actually, the birth of a child is usually a really good time. People tend to be more receptive to messages at that point. So I think what we need to do is get in obstetricians' offices and actually talk to them about messaging for the parents and see what kind of programs we can put together there. Thank you.
Thanks for your.
Oh, I think, yeah.
I just wanted to thank you for your comments on El Paso. I'm Ann Gates from UT El Paso.
Oh, great.
And so just as you pointed out, there's been a strong initiative within El Paso through media all the way up. The El Paso Health Foundation has just created a partnership with UT El Paso, Texas Tech School of Health, Paul Foster Medical School, and the UT School of Health. And so they're using a socio-ecological approach, just as you mentioned, that goes from the individual, community, policy, all the way across all of those levels. So we should see even more results coming from this effort.
Thank you for pointing that out. Thank you.
Thanks for that wonderful presentation. I thought your bar graph showing the number of minutes of education was very compelling, particularly tying back to some of the other earlier discussions about cigarette smoking and awareness. And really shocking, if you will, that schools are spending so few minutes talking with children about this very serious problem. What is the status of interest in Texas K through 12 education community about changing the status quo? Are they being proactive and moving aggressively for more awareness and education of students, or just the opposite? I'd be curious about the education community's awareness. And again, thank you for your talk.
Thank you very much. That's a great question. I think if you ask teachers and administrators what they think about health education, they say that they value it very much. However, when the rubber meets the road and they're facing all these educational cuts, it really falls by the wayside. And just to give you one example, is this last legislative session, we are known in the United States for our efforts with coordinated school health. So it's been CATCH and other programs. CATCH is one of those evidence-based PE programs that Dr. Dietz talked about. With this last session, we almost lost coordinated school health requirements for elementary school. And it came down to a vote over Father's Day weekend, and we had to mobilize. We did a grassroots mobilization. Well, I didn't do it, but an advocacy group did, to get people out to talk about that, because several of the superintendents are kind of saying now we have so many unfunded mandates, and this law is an unfunded mandate, and we can't ask our teachers to do more. So now that said, a lot of the PE teachers and school food service are really broadly supportive of this. But I really think organizations like this and those of us that are engaged in science and medicine really need to be advocates for this and talking to our legislators and saying, you know, this is important. How can we not have health education in high school? How can we not have that as part of the curriculum? So we really need that, I think, to move forward. Thank you.